Hi guys, today we're going to be talking about traveling and how to do it as safely as possible. Obviously there's some information that is circulating on whether or not travel can be done safely. Some facilities have restricted travel altogether or have imposed 14-day quarantines on any staff who travel and then return to the area. We have decided not to do that. We understand that travel is really important to people, especially in the summer. A lot of people go camping, a lot of people are doing all those summertime things. And we want you guys to be able to do those things, and we want you to live your lives and enjoy yourselves. We also want to make sure that you're doing those things as safely as possible. So we've kind of designed this to give you the tools and resources necessary to make good decisions while you're traveling, to be able to see whether or not your destination is appropriate, if there's any stops along the way that are safer than others. So let's just get started. All of this information is from the CDC's website on travel guidance. It's especially pertinent to domestic travel. So I know that there's still a lot of travel bans out for international travel. So for the time being, we're going to talk about just domestic travel, leaving our communities and maybe even going out of state. And we're going to check, I'm going to show you how to check and see where you're going and how to see if there's if that area is a safe area or not. So let's go. So bottom line is that travel increases your chances of getting and spreading COVID-19. And this quote is taken right from the CDC, and you can see the link that I have posted there. Nobody really knows yet if one type of travel is safer than another. Airports, buses, trains, those are all methods of travel that put you in contact with other people, potentially put you in real close contact with other people, and make it hard to socially distance. So those methods of travel increase your risk of exposure to the COVID-19 virus a lot. So if you're considering traveling this year, we have to tell you, you have to know that COVID-19 cases and deaths have been reported in all 50 states, and the situation is constantly changing. So travel increases your chances of getting infected and spreading COVID-19, and staying home is the best way to protect yourself and others from getting sick. That is a quote that I took right out of the CDC. However, people are going to do what they're going to do, and we know that staying home all year isn't for everyone. So we've made this video to help provide some education on traveling and how to be as safe as possible. So the CDC has designed this beautiful page on their site for us. So I will poke around in this a little bit and show you how to use the site. So top considerations for traveling are listed here. We're going to go through each one of these considerations one by one, but primarily just where are you coming from, where are you going, how are you going to stay safe, and who are you traveling with. Who you're traveling with is also pretty significant. So check the CDC website for information on whether or not you're coming from an area with significant community spread prior to traveling. So if you're coming from an area that's real high risk, where active infections are increasing, it's safer to stay home and avoid spreading the virus and carrying it around the United States. So we can click this link and it will take us to the CDC's consideration for travelers, and you can see there's a link right here that says, is COVID spreading in your community? You can click on it and a map shows up of the United States. So we will click on Wisconsin because that's where we are. And then we can, we can click on this DHS Wisconsin COVID activity level. And every state has something like this on their state website, where it essentially shows you where the high-risk areas in Wisconsin are. So Wisconsin has quite a bit of community spread right now. So case indicators in the last 2 weeks means that cases have been high in a certain county. So it looks like our only low counties are Langlade, never been there, and Rusk, also never been there, which is probably why they're low. Anyway, so you can just hover over your county to see whether or not the area that you're coming from, and it's broken down by counties across the United States, the risk areas. So Monroe County, where we're at, is a high level. We're coming from an area with high positives, high infection rate. La Crosse, neighboring county, also high. Juneau, also high. Vernon, medium. Go Vernon. Okay, so that's how you do that. And are you going to a high-risk area? So check the CDC website to see whether or not you're traveling to an area with significant community spread or at a high-risk area. So plan your route too. Know where you're going, and if you need to stop for breaks, pick points ahead of time, and you can check on these maps and stuff where the low community spread or low activity levels are. So let's go here. And I played with this ahead of time so I could make sure that this, showing you how to use this wasn't going to be super embarrassing for me. So click on where you're going, and let's say you want to go to Nevada. This is not an awesome one. Thankfully, I figured out how to do this before I did this recording. So, usually you want to get to wherever this leads you. You want to get to the Department of Health and Human Services, or the Department of Health, whatever it's called. And usually there will be some sort of a search box where you'll be able to search for COVID-19 and find where the tracking is. So if you're going to go to Nevada and you want to see if it's what areas are the safest to go in Nevada, usually if you type in COVID-19, there will be something that will show up that shows the counties. So, and usually it's called a dashboard, a data dashboard, something like that. So I'm going to click on a couple states just to show you the difference, because there are a lot of differences between these websites for the states, and none of them are super easy to use. So, but this is kind of how to navigate it. So you can see Nevada's dashboard. If you click over, it looks like you can see Nevada has all of its counties highlighted up. So Clark County, I guess, looks has a pretty high rate of cases per 100,000 people. And then you can click over. Nye County has a medium risk of cases per 100,000 people. So you just kind of have to figure out, look at where you're going, and make sure that it's, a safe place. So I will go out of this here and go back to our state, because I thought I clicked on Texas before, and Texas was kind of cool. It's also, I think I remember this right, it's a lot easier to get to. So data and surveillance, COVID-19, yeah. So this one I thought was actually kind of neat. Same concept, like I said, all the states have this in some fashion, but some states are better at it than other states. Okay, so you can kind of see the dashboard for Texas, how many tests have been conducted, how many cases are reported or positive, and then you can see the counties. I don't know where our map is. There's a cool map in the middle of here. So anyway, you can see the counties and the number of cases in each county. The number of cases doesn't necessarily tell you everything you need to know about the community spread, just because you don't know, based on looking at this, the population of this county. So we're gonna zoom in here on Texas, because it looks like it's such a gigantic state, but they have their counties all blocked off, and you can see the larger circles are the areas where there's more community spread. And then the small circles have all reported. They have some cases, but alright, let's make this different. Okay, so you can also, I would know what states you're going to cross. Also check those states and make sure that you're picking areas with lower spread if you are able to, for your rest stops and refueling and food and all that stuff. And then, so another consideration was, how do you plan to get to where you're going? Because different methods of travel have different risks, so you really want to know your level of risk and prepare for it. Air travel presents a pretty significant risk just because of the potential for close contact with others at security checkpoints or on a crowded flight itself. It's really hard to social distance away from people when you're on a flight. And social distancing, hand washing, wearing a mask, those things are all like, that's the trifecta of preventing the infection. So in air, or if you're traveling or using travel methods that make that difficult, obviously your risk of exposure is higher. The same thing for buses or trains. It's likely to involve sitting within 6 feet of other people. Car travel can put you at a little bit of a risk when you're stopping for breaks and stuff. It could put you in potentially crowded areas. So things like refueling, going to the grocery store, they're considered relatively low risks, but the higher risk areas you can still come into contact with. So especially if you're traveling, if you're in your own local community, it's not as likely that you're going to go into the public bathroom at a gas station because you're almost home. When you're traveling, you don't really have another choice, and that's the problem with traveling. So that's the risky part. RV travel, you might have less risk because you won't need to stop as often for food or bathroom breaks. However, check with your destination if they've done anything. If you're staying at a campground or an RV park or something, check with that location to see if they've taken any precautions to help with social distancing to protect campers. Some have, some haven't. I would pick one that has if I was personally going to travel, but I'm not you. So anyway, keeping yourself safe, and you have appropriate materials to keep yourself safe. You really want hand sanitizer that's at least 60% alcohol. I think we have talked about this ad nauseum, but hand hygiene, number one preventer of the spread of infection, and that is true for COVID, and that's true when you're traveling, and it's true when you're at home. So wash your hands. Wear a mask in public, especially in places where social distancing might be difficult. A cloth mask is still okay to use out in public. There are some really nice ones that you can buy, and it seems like surgical masks are becoming a little bit more available now too. So if you can get your hands on some of those, if you can order them from Amazon or whatever, those are also fine. Check the CDC's guidance for disinfecting your lodging and safe products you can use, and consider packing supplies other than soap and hand sanitizer and medication and clothes. Like if you're going to an area with a potentially high spread, or you're going through areas that have a higher spread, you might be going through areas or traveling through areas with stay-at-home orders from the local governments, and so restaurants might be closed, other places might be closed. So you might want to pack food or anything else that you might need. So you can also click on this link here. Take a second to write it down if you want to. So we can click on this link, and it shows us how to clean. But basically what this says, and you can go through and look at all of the recommendations: cover your skin, use gloves, check the EPA website. Basically, anything that you normally use in your own house to clean, any product that you buy at Walmart for cleaning, or any product that you buy at, I don't know, the Dollar Tree, Dollar General, wherever you go for your stuff, all those products are pretty much going to work. So just make sure that you're cleaning your area if you have concerns about it. So that's all. Does your state or local government require a 14-day quarantine upon your return? Some local governments in some states are requiring a 14-day quarantine after traveling. I can't recall off the top of my head which states those are. We're not, or at least our area isn't. There might be some differences with international travel. Again, this is mostly designed for domestic travel. It's not recommended at all right now to travel internationally if you don't absolutely have to. But I know at this point we are not requiring, or our area is not requiring, a 14-day quarantine after you return from traveling. And then also, last consideration that I wanted to go over is, who are you traveling with? If you're traveling with a person who's ill or has a severely compromised immune system, it's best to stay home, honestly. If you are the compromised individuals not willing to stay home, consider the safety of your destination, the availability of hospitals or clinics, community spread severity in that area. Like say if you're going camping out in sort of a remote area with a person who's ill or severely compromised, think about how far away a hospital might be. People who are severely immunocompromised might or are going to get much sicker from coronavirus than others, than a healthy individual. So being able to have access to hospitals, to clinics, to medical treatment and care, emergency rooms, whatever, those are considerations that you're going to want to really take into account if you're traveling with somebody like that. Follow the other guidance in this video if you're not going to stay home, like plotting your rest points on your route, checking your destinations, checking those states that you're going through ahead of time. If you want help, I can absolutely help you and show you how to use the site. Make sure you're cleaning your hands, washing with soap and water. I can't stress it or say it enough. And then cleaning your lodging or accommodations with appropriate products, and wearing a mask when in public places. So, I don't know what just happened there. Where are we going? Here, let's go down. How did I get lost in my own PowerPoint? Okay, that's the end of that, actually. So if you have questions, you can email me at myork@morrowhome.org, or I'm pretty available a lot of the time, so come see me, ask me. If you want help navigating the CDC's website, I can help you with that. I can also hook you up with some other resources. If you want to do more research, just let me know. Thanks. Bye.